Hi, welcome to Mental Health Awareness Month. Yay! I am Michelle Palmer. I'm the Executive Director of the Wendt Center for Loss and Healing. We are a nonprofit mental health agency in Washington, D.C., and we specialize in grief, trauma, and the all-important intersection, and frankly, all too common intersection of both of those things. I'm here today to actually talk about barriers. I like to actually really think of barriers in terms of access, because barriers just feels hard, like a giant wall that we have to climb over, versus access, which to me says, how do I ask the right questions to get my needs met? So I want to talk a little bit about the Wendt Center and how we actually view access. And when I say view access, I'm talking about access not just to mental health services, and that is incredibly, incredibly important. I'm talking about access to the right mental health services for you. Sometimes we actually do need extra help. Sometimes we don't. Sometimes our family and friends can love on us, and that is really all we need. But sometimes the terrible thing that happened is so terrible that we struggle, and our family and friends struggle to provide the support that we need so that we can sort of start to understand how to access not just those services that we need, but to access the very best part of us, which oftentimes when something really hard happens, the very best part of us is the thing that gets most quiet. But I want to also talk about sort of what people as individuals can do. So oftentimes, we have heard that folks who get Medicare or Medicaid who do not have private insurance assume that mental health services are not covered by their provider. That is absolutely not true for the most part. There was a law passed called mental health parity that helped to level that playing field, that pretty much essentially said, if you offer physical health coverage, you need to offer mental health coverage. So one of the things that you can do to understand your personal access is to understand your personal insurance coverage. Another thing you can do is, let's say you have insurance that has a really high deductible and you think there's no way I can access mental health services because there's no way I'm going to be able to afford to hit that deductible. Don't assume that you can't access those services. Agencies like the Wendt Center, we have actually a lot of grant funding that allows us to serve people and never have to bill their insurance. This is particularly true if you are the victim of a crime. And so don't stop with my deductible is too high or I need pre-authorization as sort of the door that slams. The next question to be asking whomever you're calling is, do you have alternative funding sources that can cover the treatment that I need? And or do you have a sliding fee scale? And how do you determine how much that sliding fee scale is? So there's lots of other ways to fund the services that you might need outside of insurance. Another reason that people struggle with accessing mental health services is, frankly, a previously bad experience. I went to therapy as a kid. It was terrible. I hated my therapist. It felt like punishment. I'm never doing that again. Or I tried therapy. I didn't hit it off with my therapist. I went twice and therapy's just not for me. The way that I think about therapy is the way I think about how I find a really excellent pair of jeans. So if you're anything like me and you're on the hunt for a really excellent pair of jeans, you go to the store and you probably pick out, I don't know, 3 to 10, if you're me, 15 different pairs of jeans. They're made by different people, they're different sizes, they have different cuts. And it may take all 10 different pair, or again, if you're like me, 15 different pair to find the pair that feel exactly right on you. Now, I'm not saying you have to go through 15 different therapists, but what I am saying is that finding a therapist that feels like a really good pair of jeans might take a little while. And it is absolutely okay to tell the agency that you are working with that this just doesn't feel like a fit. I would like you to connect me with a different therapist. And if you can even help them understand what part of it didn't feel like a fit, even better. Not necessarily, but even better. I think another pretty significant, and I am going to use the word barrier here, barrier to accessing mental health services is really the pervasive stigma around mental health. Sort of that, what are people going to think if they see me going into a therapist's office? Or what are people going to think if they find out that I'm going to see a therapist? Or what if my employer finds out I'm going to see a therapist and they think, oh, well, that must mean that I'm crazy. The way that we break down stigma is that we have the courage to access what we need, and we have the courage to talk about it. Stigma around mental health is not going to go away until we all get brave enough to say, you know what, life is hard. And sometimes it is so hard that I need a little extra help navigating it. And frankly, if we are completely honest, that is generally the human condition. Everything's going okay, and then we hit and sometimes that is hard to get out of. And sometimes we just need some extra help. We need some professional help, somebody who can hear us, who can give us perspective, who can give us tools. You know, one of the ways that I sometimes think about therapy is if you have ever gone to the gym or you're at all sort of gym inclined or athletic in any way, I often think of therapy as a personal trainer for my brain and my heart. And so it's really not because you're broken that you access mental health services. It's actually because something happened and you were trying to get back to your best self and accessing your best self. And here's the great thing about therapy that I think a lot of people don't know. Oftentimes, when we go to therapy, we not only access our best selves, but we actually elevate our best selves. And our quality of life improves to actually beyond what it was before whatever the terrible thing was. And so therapy, mental health therapy, grief therapy, trauma therapy, that is not about being a broken person. That is about having hard things happen because we live in this life and having the courage enough to say, you know what, I want to feel better, so I'm going to do something about it. Which kind of gets me to the last sort of piece of access that I want to talk about, which is oftentimes people don't believe that they can ever feel better, either because they have felt so bad for so long, or because the thing that happened has been so devastating that it is hard to ever imagine that you are ever going to be able to laugh, to smile again, to enjoy company again, to remember people who have died who you love with a smile and a warmth instead of tears and dread. That is a huge barrier. And the sort of I guess sort of the spoonful of sugar to that is actually believing that you can, believing that healing is not only possible, healing is more likely than not. And it is oftentimes far less painful and scary than we ever imagined it would be. And so believing that you can and will feel better is probably, frankly, that first step, or even believing that it's a possibility, is probably that first important step to, improving and increasing access. So again, so that we can all of us, get the services that we need to heal, to access our very, very best selves and live a rich life that is full of love and laughter and happiness and tears and stress and all of the things that make a full life full. So thank you for listening to me. And I wish you happiness, and I wish you health, and I wish you excellent, excellent therapy.